There has been a lot of confusion around this all, so we want to bring in Dr. Paul Offit. He is the director of the Children's Vaccination Center at the Children's Hospital of Philadelphia, a former member of the FDA Vaccine Advisory Committee. Dr. Offit, we appreciate you making time. So we know there have been changing recommendations, some mixed messages on this here. We're hoping you can help clear this up for many Americans who are having conversations in their households about whether or not they or their family members should be getting the shot. What are the best practices as folks make those decisions?
Right. So we don't have an advisory committee for immunization practices anymore. We have they were fired by Robert F. Kennedy Jr., all 17 members. So now what we have are people who, like him, have an anti-vaccine, anti-science bias, which is why the medical community is largely ignoring them. So the question is, for the standpoint of the parent or the patient, is that regarding COVID vaccines, if your child has never been vaccinated or naturally infected, they should get a primary series. Otherwise, in terms of a yearly vaccine, we should do what every other country in this world is doing, which is to make sure we target high-risk groups, those who are most likely to be hospitalized, those who are most likely to die, the elderly, people who are immune compromised, people who have high-risk medical conditions like chronic heart or lung disease, and pregnant women, which is pretty much what every country does. And I do think the good news is that all those people should be able to get a vaccine, and it should be covered by insurance.
Dr. Offit, it's not just COVID, right? There's also been changes to sort of the recommendations around measles, mumps, and rubella. So how should parents at home who are waking up, watching us right now, be navigating this with their pediatricians for their young ones?
So that wasn't as big of a deal. I think what we do at Children's Hospital Philadelphia is that we recommend for children 12 to 15 months of age that they get the measles, mumps, rubella vaccine and the chickenpox vaccine separately, and then at 4 to 6 years of age they can get it as a combined vaccine. And that's pretty much what this group has said. This new look ACIP, but they've made it a little more difficult for anybody who wants to get that first dose as measles, mumps, rubella, varicella. I don't think that's going to be a big hit. About 15% of people get that first dose as the combined vaccine. It'll be hard for them to get it that way.
All right, Dr. Offit, appreciate your time as folks try to work through all the changes here.
Yeah, appreciate it. Dr. Offit, thanks for speaking with us.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.